What advice would you give someone living with HIV who feel that they're being silenced?
So I think it's really important to know, first of all, that you're not alone. This is something that is really widespread, and also it's not your fault. So I think people sometimes worry that it's down to them that this has happened, but it's not at all. This is a widespread, and it's a really historical issue. It's kind of ingrained in medicine, which I explore. But, there's a few things you can do. I think if you have a trusted friend who you feel, able to bring to your appointment with you, that can be really helpful, because they can be there as kind of, psychological support, but they can also help remind you of what you wanted to ask your doctor about. They can stick up for you if you need to, and also they can help you remember what was said in the appointment. I think it's also really important to come prepared. So think about, what do I want from this consultation? What do I want out of my doctor? And don't be afraid to bring a list. I think people always really worry, but actually, we don't mind lists. It shows, one, that you're really prepared and, you're organized and you care about your health. It makes your doctor care about your health more if you come prepared. Bring a list of your medications, all that kind of thing is really helpful. And I think it's also really important to make sure that we know if you have any communication needs. So do you need an interpreter? Is there something that we can do to help you in the consultation? And finally, I would say, know your rights. So know you're always entitled to a second, third, fourth, fifth opinion. And again, I think people think that, we might be offended by that as doctors, but actually we ask each other for advice all the time. So we're actually very used to it. So feel free to ask. Know that you can complain if you really need to, and know that you are absolutely entitled to high quality healthcare. So make sure that, you get the healthcare that you deserve.